Why is moaning or humming recommended during labor and delivery? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. This is a great question, and I want to go over exactly why you might have heard that or it's been recommended to you to try that during labor and delivery. So I'm going to show you this female pelvis here, and you can see down inside these pelvic floor muscles. And you can see how they run front to back, basically behind the pubic bone here, and they continue on back to the coccyx and the sacrum, and they fill the space all the way underneath there. Think of that as being like the whole bottom of your back and your pelvis. Okay, and then I'm going to flip this over so you can see it here. So you can see the vaginal opening here and the rectum there. And you can see how these muscles from the labia, they fan out from the labia. They come over and attach onto these sits bones underneath, and they fill this space here as well. So when you're in birth and you are allowing, baby to come on down into this area, and we're trying to have a vaginal birth, you can imagine that we don't want these muscles really tight and keeping baby back. We want them to relax and allow baby to flow on through and come on out. I'm going to show you on this model here that actually moves, so you can kind of overlay what you just saw with those muscles onto this bony pelvis that moves. So if we can imagine baby coming down and head down and kind of facing towards the back side of mom, right? Coming down into this area, and basically what happens in mom's body is that these bones here along the top have to kind of open up, and then the base of the sacrum here moves back. So that widens that space, okay? And then baby keeps moving on down. So, imagine that you can be in different positions, hands and knees, or squatting, or standing, or, on your back, laboring on your side, whatever. And your body can be, going through these motions. So as that happens, baby comes on down, works his or her way down in there. And then you can see here, we would want this to kind of open up to allow baby to come on through, right? So these sits bones here open up this way, and that coccyx and sacrum move towards the back, and that widens, that allows baby to come on through. So again, going back to this model here where we have those muscles down in there, if they're tight, that's going to possibly hinders baby's ability to come on through that vaginal opening, right? So the reason that you have been advised to like moan or hum or make some noise is because that can help to relax these muscles and allow this to flow a little more smoothly. Now, one caveat with that I want to say is that when you are humming, moaning, you really want to get those really low sounds, because they have found that that actually helps to relax the pelvic floor. So one extra tip I want to give you that I talk to my moms that I work with a lot of pregnant moms and help prepare for birth, and help prepare these pelvic floor muscles and the mobility around this pelvis so that we can have that natural mobility and flow during birth. But what I teach them is practice that at home, because a lot of women feel kind of silly. They don't want to do it. And, even when we practice here in the clinic, practice some pushing, sometimes I'm like, okay, we have to bring in those low sounds, the humming and the moaning maybe, and to help them connect in with these muscles to allow them to actually let go. And some of the moms I work with feel kind of silly, and I get it. I totally get it. So I tell them, you know what? Go home and practice just getting your voice out there so that you get used to hearing your own voice. You get comfortable at home. That way, when you're in labor and delivery, you're not holding yourself back because you kind of feel silly, okay? Whether that be at a home birth or birth center or hospital. So practice that at home, and yeah, you'll be ready for the big day. So if you're watching this and you're currently pregnant or are planning to become pregnant soon, and you want to know a little bit more about how to prepare your body and prepare more for a smoother pregnancy, smoother birth, and postpartum recovery, reach out here to the Healing Spot. head to our website, healingspotpt.com, and choose whatever option works out the best for you. And we would love to answer any questions that you have and get you on your way. Thanks for watching.